Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Implantable Cardioverter Defibrillator. Introduction. Irregular heartbeats are a serious condition that can cause death if not treated. An implantable cardioverter defibrillator is a small device that's placed inside your chest or abdomen to help control irregular heartbeats. Implantable cardioverter defibrillators are also called ICDs. Thousands of patients have ICD surgery each year. Although an ICD does not cure heart disease, it can reduce a person's risk of dying. Your healthcare provider may have recommended that you have an ICD. The decision to have this procedure is also yours. This program explains the benefits and risks of having an ICD. It discusses diseases that require an ICD, how the procedure is performed, the benefits and risks of the procedure, and what to expect after the procedure. The heartbeat. An ICD helps to control an irregular heartbeat. This section will help you understand irregular heartbeats. The heart is the most important muscle in the body. It has a right and a left side. Each side has two chambers, an atrium and a ventricle. Blood flows from the body into the right atrium. From there, it is pumped to the right ventricle. The right ventricle pumps blood into the lungs. In the lungs, blood is loaded with oxygen. From the lungs, blood goes to the left atrium and then to the left ventricle. From there, it is pumped to the rest of the body, and the cycle repeats. A normal heart rate varies between 60 and 100 beats per minute while a person is at rest. A heartbeat starts when the heart receives an electrical signal. Each electrical signal results in one heartbeat. Any interruption to the normal flow of electrical signals in the heart results in an abnormal heartbeat. Any change in the way the heart normally beats is called an arrhythmia. During an arrhythmia, the heart can beat too fast, too slow, or with an irregular rhythm. Most arrhythmias are because of a problem in the electrical system of the heart. Some arrhythmias can cause the heart to suddenly stop beating. This is called sudden cardiac arrest. If the heart stops beating, blood stops flowing to the brain and other parts of the body. This usually causes death if not treated within minutes. The two most common abnormal heart rhythms that lead to cardiac arrest happen in the ventricles of the heart. The first is a dangerously fast heartbeat called ventricular tachycardia. The other is a rapid and chaotic heartbeat called ventricular fibrillation. It makes the heart shake very quickly. A fibrillating heart can't pump blood to the body. If not treated, the person will pass out within seconds and die within minutes. For years, healthcare providers have treated ventricular fibrillation by giving the patient a strong electrical shock to the chest. This is called defibrillation. One thing an ICD does is deliver a strong electrical shock to defibrillate the heart from the inside. This is a life-saving measure. ICD. The Implantable Cardioverter Defibrillator, or ICD, is a smart device that is smaller than the palm of the hand. It consists of a box and wires. The wires connect the box to the chambers of your heart. At the end of the wires are little sensors called electrodes. The electrodes sense electricity from your heart and send electrical shocks. The metal box is implanted under the skin of the chest or abdomen. The box houses very delicate electronic circuits as well as a battery. A small computer monitors and stores information about the heartbeat and, if needed, generates an electric current that normalizes the pulse. The wires constantly monitor your heartbeats and send the signals to the computer. The computer analyzes the heartbeats and stores the information so the healthcare provider can look at it later if needed. If the computer notices an abnormal heart rhythm, It tells the pulse generator to deliver the appropriate electrical shocks through the wires to the right part of the heart. This helps the heartbeat go back to normal. The ICD wires may go to one or both ventricles of the heart. They may also go to the ventricle as well as to the atrium. Your healthcare provider will decide which ICD is best for you based on the type of arrhythmia you have and your medical history. Screening. Not every person that has irregular heart rhythms is a candidate for ICD surgery. Your healthcare provider will diagnose your arrhythmia and determine if ICD surgery is an option for you. Usually, healthcare providers recommend ICD surgery for patients that have certain life-threatening ventricular arrhythmias. They also recommend ICD surgery for patients who have had a heart attack that damaged the electrical system of the ventricles. An ICD is often recommended for people who have survived sudden cardiac arrest. Cardiac arrest is when the heart stops altogether. To diagnose your arrhythmia and screen you for ICD, your healthcare provider may ask you to have one or more of the following tests: electrocardiogram, Holter monitor, event recorder, echocardiogram, electrophysiology study, stress test. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Healthcare providers can treat certain arrhythmias with medications and a pacemaker. A pacemaker is a device that is similar to an ICD. They are both implanted under the skin with wires going to the heart, but a pacemaker can only give off low-energy electrical pulses. They cannot defibrillate the heart. Pacemakers are often used to treat less dangerous heart rhythms, such as those that happen in the upper chambers of your heart. An ICD can act as both a pacemaker and an ICD. They can send weak or strong electrical pulses when needed. Subcutaneous ICDs, or SICDs, use a pulse generator placed in the underarm and an electrode placed along the breastbone. The pulse generator and electrode deliver certain kinds of shocks near the heart rather than through wires placed in the veins. Your healthcare provider can tell you whether an SICD is a good alternative to a traditional ICD in your case. Surgery. Placing an ICD requires minor surgery, which is usually done in a hospital. You will be given medicine right before the surgery that will help you relax and may make you fall asleep. First, your healthcare provider will thread the ICD wires through a vein to the correct location in your heart. Once the wires are in place, your healthcare provider will make a small cut into the skin of your chest or abdomen. He or she will then slip the metal box part of the ICD through the cut and place it just under your skin. Once in place, your healthcare provider will test your ICD. You will be given medicine to help you sleep during this testing so you don't feel any electrical pulses. Then your healthcare provider will sew up the cut. Risks and complications. Implanting an ICD is a very safe operation. Risks and complications are rare, but they are possible. Knowing about them may help you detect them early if they happen. Like any surgery, ICD surgery has the risks of bleeding, infection, and scarring. Infection may require taking antibiotics and sometimes replacing the ICD. The scar may be painful or unsightly. The pulse generator may create a small bulge under the skin. Like any surgical procedure, you may have a bad reaction to the medication given to relax you. Your healthcare provider will discuss with you the medication used. Let him or her know if you have any allergies or have had any reactions to medications in the past. Although rare, some risks are related specifically to ICD surgery. These include a collapsed lung and damaging a blood vessel, nerve, the heart, or the lungs. Some risks are related to the device itself. An ICD can give pulses when they aren't needed. Pulses delivered too often or at the wrong time can damage the heart or trigger an irregular heartbeat. Pulses delivered at the wrong time can also be painful and emotionally upsetting. If this happens, your healthcare provider can analyze the recording of the heart rhythms and reprogram the ICD so the pulses happen less often. Medications can also be prescribed to control the pulses. There is also the rare risk that your ICD won't work correctly. In this case, your ICD wouldn't correct irregular heart rhythms. If your ICD malfunctions, your healthcare provider may be able to reprogram it. If that doesn't work, the ICD may need to be replaced. The wires of the ICD may break, come loose, or lose their connections with the heart. If this happens, another procedure may be needed to reposition the wires. People with an ICD may have a higher risk of heart failure. Heart failure is when your heart can't pump enough blood throughout the body. It's not known for sure whether an ICD increases the risk of heart failure or whether heart failure is just more common in people who need an ICD. After surgery. You will probably be in the healthcare facility for 1 to 2 days after your ICD surgery so your heartbeat can be monitored and your healthcare provider can make sure your ICD is working correctly. You will need to arrange a ride home from the hospital. Ask your healthcare provider when it's safe to drive yourself around. For a few days to a few weeks after surgery, you may have pain, swelling, or tenderness in the area where your ICD was placed. The pain is usually mild, and over-the-counter medicines can help relieve it. Ask your healthcare provider before taking any pain medicines. Your healthcare provider may ask you to keep the incision site dry for up to 10 days. If your healthcare provider allows a sponge bath, make sure to dry the incision site well after the bath. Your healthcare provider might ask you to avoid strenuous exercise, contact sports, and lifting anything that weighs more than a pound for about a month. You should also avoid vigorous activity above the shoulders, such as swimming, biking, tennis, golf, bowling, and vacuuming. Most people return to normal activities within a few days of having ICD surgery. Ask your healthcare provider when you can go back to work. The length of time that you must stay home from work depends on your specific job and health condition. Ask your healthcare provider what types of stitches will be used and if you need to schedule a follow-up visit to remove any of them. Also ask which types of medicine you should use. Your healthcare provider may prescribe some antibiotics to prevent infection. Call your healthcare provider immediately if you notice any of the following signs which may indicate infection: drainage at the incision site, red or hot incision, fever, living with an ICD. As you decide to have ICD surgery, you should know how your life will be affected by the ICD. This section describes how your life may be a little different than before. The low-energy electrical pulses your ICD gives off aren't painful. You may not notice them, or you may feel a fluttering in your chest. The high-energy pulses your ICD gives off last only a second and feel like a thumping or painful kick in the chest, depending on their strength. You may need to take medications in addition to having the ICD to control your irregular heartbeats. People with ICDs may still faint. Fainting while driving a car poses a safety risk for you and others. Some people need to go 6 months without fainting before they can drive again. Ask your healthcare provider how long you should avoid driving after surgery. Many states will not give a commercial driver's license to people with an ICD. You should avoid any kind of heavy blow to the skin over the ICD. For example, if you hunt, fire the gun against the shoulder that does not have the ICD. You may need to avoid full-contact sports, such as football. Such contact could damage your ICD or shake loose the wires in your heart. Ask your healthcare provider how much and what kinds of physical activity would be safe for you. You should not allow magnets to come closer than 6 inches from your ICD because they can make it function incorrectly. Many people with ICDs should never get an MRI or be near one, since MRI technology uses a very big magnet. Some newer devices may be compatible with certain types of MRIs. For certain kinds of ICDs, some other medical procedures are not recommended. These may include microwave ablation, radiofrequency ablation, and magnetic resonance angiography, MRA. Let all your healthcare providers know you have an ICD and ask your healthcare provider what medical equipment you should avoid. Devices that could interfere with the ICD include cell phones and mobile devices. You can talk on a cell phone, but it is important not to let a cell phone that is turned on come within 6 inches, 15 centimeters of your ICD. If possible, hold the phone next to the ear farthest away from your ICD. MP3 player headphones. Don't let your headphones come within 6 inches of your ICD. You should avoid close or prolonged contact with some electrical devices. Stand at least 2 feet, 0.6 meters away from welding equipment, electrical generators, high voltage transformers. You should let airport screeners know that you have an ICD. Your healthcare provider can give you a card that states what kind of ICD you have. Carry this card in your wallet. Airport security devices do not harm ICDs. The metal box of the ICD should not set off the security alarm at airport security checkpoints. But if this should happen, show your ICD identification card to the security guard. It shows the company that made your ICD. Someone can check you with a metal detector wand as long as it is not held for more than 30 seconds over your ICD site. Try to avoid sitting or standing close to a metal detector since it contains a magnet. Your healthcare provider will want to check your ICD regularly. Your healthcare provider may ask you to come in for an office visit several times a year. You will need to replace the battery of the ICD every 5 years. ICD batteries last between 5 and 7 years. Your healthcare provider will replace the generator along with the battery before the battery begins to run down. Replacing the generator and battery is a smaller surgery than the original surgery to implant the ICD. The wires of your ICD and the ICD box may need to be replaced eventually. Your healthcare provider can tell you if your ICD or its wires need to be replaced. This depends on whether the ICD was damaged by electrical signals, magnets, or blows to the body. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. An Implantable Cardioverter Defibrillator, or ICD, is a small device that is placed in your chest or abdomen to control dangerous irregular heartbeats. The ICD will continually monitor your heart rhythm. When needed, it delivers electrical pulses to the heart to help restore regular rhythm. The surgery to place an ICD is relatively safe. Some risks and complications exist. Knowing about them may help you detect them and treat them early. Like any electrical and mechanical device, the batteries have to be replaced every 5 to 7 years. The surgery to replace them is very simple and can be done while you are awake. Eventually, the ICD or its components may have to be replaced if it is damaged. ICDs can save lives. They can deliver high-energy electrical shocks when the heart fibrillates, but they may affect your lifestyle. Learning how to cope with an ICD can help you extend its life and yours. Thank you for using Explain.